Welcome back, everyone, to the deep dive. This time, we're getting pretty granular, going microscopic, really. We're going to be exploring this tiny protein fragment. It's called D-dimer,
Yeah.
and it can actually, believe it or not, tell us a lot about what's happening inside your body.
It really is fascinating, like a little window into your health.
All right, so set the stage for us. What exactly is this D-dimer, and why should we care about it?
Okay, so picture this, right?
Yeah.
Your blood, it's like a busy highway.
All right, I'm visualizing.
Okay, now sometimes, you get those fender benders, accidents happen.
Oh.
Those are like blood clots, right? And your body, it's got its own system for clearing those up, kind of like a tow truck, right?
I'm with you. Keep going.
So that tow truck, it removes the wreckage, gets rid of that clot. But there's always going to be some debris left behind, right?
Makes sense.
That debris, that's kind of what D-dimer is. It's a byproduct of that whole clot breakdown process. Okay, so if I'm getting this right, higher D-dimer levels could potentially mean more clotting activity. So does that mean if my D-dimer is high, I've automatically got some dangerous clot hiding out somewhere?
Well, not necessarily. That's where things get a little tricky. See, a high D-dimer, it can indicate a clot, that's true, but it can also be elevated for a whole bunch of other reasons.
Like what?
Well, think like recent surgery or inflammation, even pregnancy.
Oh, interesting.
It's kind of a multifaceted little protein, that D-dimer. And so that's why doctors they mainly use this D-dimer test, to rule out those really serious clotting conditions.
Okay, so give us some examples of those. What are we talking about here?
Sure. So we're talking like deep vein thrombosis, that's DVT,
Yeah.
or a pulmonary embolism, PE, especially in people who, aren't considered high risk.
Ah, so it's a way to avoid like more invasive testing or procedures?
Precisely. It's really efficient. A negative D-dimer in a low-risk patient, that's incredibly reassuring, I'd say.
Okay, that makes sense. So it's like a first line of defense, helping doctors decide who needs more investigation and who's probably in the clear. So let's say I get this D-dimer test. What's considered normal? What am I aiming for?
Well, typically, the standard range is less than 0.5 micrograms per milliliter.
Okay.
But, it's important to keep in mind that those ranges, they can vary a little bit between labs.
Right.
And as always, the best thing is to chat with your doctor about your results specifically, get their take on it.
Makes sense. Personalized medicine and all that good stuff.
Exactly.
But let's say, hypothetically, my D-dimer comes back and it's elevated. What next? Is that a guaranteed sign of a dangerous clot?
Well, not quite. Not a guarantee, I'd say. It's kind of like, think of it like a smoke detector going off. It could mean there's a real fire, a genuine problem. Or it might just be that you burned the toast.
Burnt toast. All right.
So, high D-dimer. It's a signal to investigate further, definitely. But it's not the be-all and end-all diagnosis, you know what I mean? It's one piece of the puzzle, not the whole picture.
All right, so D-dimer alone isn't calling the shots. So what other clues, what other things are doctors looking at alongside D-dimer to figure out what's going on?
Well, they're going to be considering the whole context, right? So we're talking about your symptoms, what you're experiencing, your risk factors, past medical history, the whole shebang.
So paint me a picture. Let's say someone comes in with leg pain and swelling, maybe even shortness of breath. What are doctors thinking then?
Right. Well, those could be, those are classic signs of what we call VTE, venous thromboembolism.
VTE. Okay, break that down for me. What exactly are we talking about?
So VTE, it's kind of an umbrella term. It includes DVT, which is deep vein thrombosis, basically a clot in a deep vein, usually in the legs. And then there's PE. That's when a clot breaks loose, it travels to the lungs. So you can see how it's kind of a domino effect.
Got it. So DVT can turn into PE. That's why catching it early is so important.
Exactly. And that's where D-dimer can be really helpful. If it's elevated and we're suspecting VTE, well, that kind of bumps things up the priority list.
So walk me through those next steps. What happens then?
Well, then it's time for imaging, to get a clearer picture. So for suspected DVT, we'd probably do an ultrasound. For PE, maybe a CT scan.
So those tests actually show the clot, if there is one.
Exactly. They give us that confirmation, visual evidence.
So D-dimer helps guide those decisions, potentially avoiding those extra tests if they're not needed?
Precisely. It's about, using the information we have wisely to get the patient the most appropriate efficiency, right?
Now, earlier you mentioned that D-dimer, it's not always about dangerous clots. It can be elevated for other reasons. Can you give me some more examples of what might throw off those results?
Absolutely. So we talked about recent surgery, pregnancy, but really anything that involves inflammation, an infection, liver disease, even just the aging process. As we get older, Our D-dimer naturally tends to creep up a bit.
Really? Even without any clotting issues?
Yeah, just kind of part of that whole aging thing. Our bodies change. So a level that might be, a cause for concern in a younger person, it might be perfectly normal for someone older.
So it's not just the number itself, it's about the context.
Precisely. Age, health history, symptoms, all those things matter.
It really highlights the importance of looking at the whole person, not just one single lab result.
Couldn't agree more.
Now, I do want to touch on another condition where D-dimer plays a role. You mentioned it earlier, DIC, disseminated intravascular coagulation.
Yeah, that one.
That one sounds a little intimidating, I have to admit.
It is a serious condition, yeah.
So give us the rundown. What exactly is happening in DIC?
Imagine your body's clotting system just going completely haywire.
Uh-oh.
That's basically DIC in a nutshell. You get widespread clotting throughout the body, and that depletes those clotting factors.
Clotting factors. Remind me what those are again.
Yes, so those are like the essential ingredients your body needs to form clots.
Right.
But in DIC, because you're using them up so fast, you can actually end up with both clotting and bleeding problems at the same time.
Whoa, that sounds complicated.
It is. It's a delicate balancing act for the body to manage.
So where does D-dimer come into play with all of this?
Well, because there's so much clotting activity happening in DIC, those D-dimer levels, they usually skyrocket. They're very high. And the interesting thing is, we don't just use D-dimer for diagnosis in DIC.
Oh, okay.
It's also super valuable for monitoring, how severe the condition is and how well the treatment is working. It's kind of like a gauge.
So it's not just a one-time snapshot, it's an ongoing tool.
Exactly. And it really shows how versatile D-dimer can be as a marker.
But we have talked a lot about its limitations, those false positives especially.
Right, the burnt toast scenario.
Exactly. So can you remind us again about what can cause those false positives and why it's so important to keep them in mind?
Yeah, it's all about remembering that D-dimer. It's just reflecting clotting activity, whatever the trigger might be. Okay? So age we talked about, recent surgery, any trauma, even strenuous exercise.
So if I go run a marathon, my D-dimer might be temporarily high?
It's possible. It's
Yeah.
all about context. And that's why doctors, they got to look beyond just that single number. They have to understand your individual circumstances, your symptoms, all the other test results before making any big decisions.
It really is a bit of a detective story, isn't it? With D-dimer as one of the clues.
I like that analogy, a medical mystery.
Yeah.
And like any good detective, doctors need to gather all the evidence before cracking the case.
And sometimes that means looking beyond the obvious, considering all the possibilities.
Absolutely. It's about thinking critically and using all the tools at our disposal to make the most informed decisions.
And that's what good medicine is all about, isn't it?
It is. It's about combining the science with the art of listening, observing, and putting all the pieces together.
Well said. I think this has been a really enlightening conversation, and I hope our listeners feel a little more empowered now to understand their own health.
Me too. Knowledge is power. And when it comes to our health, the more we know, the better equipped we are to advocate for ourselves and make informed decisions.
So the next time you hear about D-dimer, you'll be able to ask those informed questions and understand what it all means in the context of your own health journey.
Exactly. And remember, your health is a journey, not a destination. It's about ongoing learning, asking questions, and partnering with your healthcare providers to make the best choices for you.
I think that's a perfect note to end on. But before we wrap up completely, we're going to take a quick break for a word from our sponsors. We'll be back in a moment to continue our deep dive into D-dimers.
And we're back, diving right back into our exploration of D-dimer.
Yeah, picking up where we left off.
Exactly. So we were just talking about how D-dimer, it's really just one piece of the puzzle, right? It's not the whole picture when it comes to diagnosing these clotting conditions. Absolutely. It's all about context, Got to consider the whole patient, not just a single number.
And that's where that communication between patient and doctor, it
Right.
really comes into play.
Oh, absolutely, 100%.
So how can understanding D-dimer specifically, how does that help me as a patient when I'm talking to my doctor?
Well, think about it this way, right? You go to the doctor, maybe you've got some leg pain, some swelling, could be signs of a clot.
Right.
Knowing about the D-dimer test, you understand why your doctor might order it and what those results could mean. You're not just sitting there, worrying in the dark.
I see. I'm an active participant in my healthcare.
Exactly. You're empowered. You can ask those informed questions.
Right. Instead of just being anxious, I can ask, okay, doc, if my D-dimer is high, what are the next steps?
Precisely. You can advocate for yourself, feel more confident about those decisions being made.
It takes me from passive patient to like an actual partner in my health journey.
That's the goal.
That's what we like to hear.
Absolutely.
Now, we've talked a lot about false positives, that smoke detector going off when there's no real fire.
Right.
But what about the flip side? Are there ever false negatives? Can you have a normal D-dimer and still have a clot?
Yeah, it can happen, although it's less common than those false positives.
Okay, so under what circumstances might that happen?
Sometimes it happens in cases of chronic clotting, long-standing clots, or if someone's on blood thinners.
Right, because those are already breaking down the clots.
Exactly. That's why clinical context is so important.
Mhm.
A normal D-dimer, it doesn't give you a free pass.
It's not a guarantee.
If other signs and symptoms are pointing towards a clot, we got to investigate further.
So it's like D-dimer is a witness in a trial, right? It gives its testimony, but it's not the only evidence the jury's going to consider.
That's a great analogy. It really emphasizes that doctors, they need to weigh all the evidence, medical history, symptoms, exam findings, and of course, those other test results before reaching a verdict.
Right, and that's where their expertise comes in, knowing how to put all those pieces together.
Couldn't agree more.
Now, earlier you mentioned that as we get older, those D-dimer levels tend to naturally rise. Can you elaborate on that a little bit? What's going on there?
Well, like with most things, right? As we age, our bodies change.
Yeah, that's for sure.
And that includes our clotting systems,
Hmm.
Our blood, it naturally clots a little easier, and we just have higher baseline levels of D-dimer, even if there aren't any clots present.
Interesting. So it's not necessarily a bad thing. It's just part of the aging process.
Right. It's like, think of it as our internal highway. It gets a little more prone to fender benders, even without any major accidents.
So a D-dimer level that might set up alarm bells in a younger person, it might be perfectly normal for someone older.
Exactly. Doctors, they're aware of this, so they use different thresholds for different age groups. It's all about interpreting those results in the right context.
So once again, it's not just about the number itself. It's about understanding the whole story. The individual's age, health history, symptoms, it all matters.
It does. And it highlights how important those conversations with your doctor are, especially as you get older. Don't be afraid to ask questions, share any unusual symptoms, be proactive.
Because early detection, that's key, whether we're talking clots or any other health concern.
Absolutely. The sooner we catch something, the better the chances of successful treatment, and preventing those complications down the road.
It's about taking charge of your health, being an active participant.
100%.
Now, before we move on to our final thoughts on D-dimer, I want to touch on something you hinted at earlier, the potential future of this test. You said it could become even more powerful and specific.
Oh, yeah, that's the exciting part, the cutting-edge stuff.
So right now, we know D-dimer, it's a general marker of clotting activity.
Yeah.
But you're saying we could potentially get even more granular with it.
Exactly. Imagine if we could use D-dimer to pinpoint the actual cause of that clotting activity.
So instead of just knowing there's debris on the highway, we could identify what kind of debris it is.
Precisely. Like, is it from a car accident, a construction project? What's the source?
That would be amazing.
Right. And scientists, they're already exploring this, looking at different subtypes of D-dimer, seeing if certain patterns correlate with specific conditions.
So give me an example. What kind of things could we potentially pinpoint?
Well, for instance, some D-dimer patterns, they might be linked to inflammation, while others might suggest a higher risk of cancer.
Wow, that could revolutionize how we approach diagnosis and treatment.
It really could. It's the future of personalized medicine, using these biomarkers like D-dimer, not just for general screening, but to really tailor treatments to each individual situation.
It's like moving from a one-size-fits-all approach to a custom-tailored suit.
Exactly. And while this technology, it's still early days, it's pretty incredible to think about the possibilities.
So even though we've learned so much about D-dimer today, the journey's not over.
Oh, not even close. That's the beauty of science. It's constantly evolving, always pushing the boundaries of what we know.
And that's what makes it so exciting.
Absolutely. There's always more to discover, more to learn.
And I think that's a great mindset to have, not just in science, but in life, Always be curious, keep exploring.
Couldn't agree more.
Well, I think this has been an incredibly insightful deep dive into D-dimer. We've covered a lot of ground, from the basics to the cutting-edge research.
It's been a pleasure.
But before we sign off completely, I do want to leave our listeners with a final thought. something to ponder as they continue on their own health journeys.
Sounds good.
So we talked about how D-dimer, it's like a smoke detector, right?
Yep.
But sometimes that smoke detector, it can be a little too sensitive going off even when there's no real fire. Those false positives we talked about.
Right, right.
But imagine if we could make that smoke detector even smarter. What if, instead of just detecting smoke, it could tell us exactly what's burning?
Now that would be game-changing.
Wouldn't it? Imagine knowing whether that elevated D-dimer is due to a clot, inflammation, or something else entirely.
The level of precision, it would be incredible.
And that's the ultimate goal, right? To use these tools to not just diagnose, but to predict, prevent, and personalize treatments.
Absolutely. That's the future we're working towards.
And it all starts with awareness, with education, with having these conversations.
I completely agree.
So to our listeners out there, keep asking questions, stay curious, and never underestimate the power of knowledge when it comes to your health.
Well said.
And on that note, we'll wrap up our D-dimer deep dive. Until next time, keep exploring, keep learning, and stay well.
Thanks for listening, everyone.
And we're back, wrapping up our deep dive into the world of D-dimer.
Yeah, it's been a journey, hasn't it?
It really has. We've gone from, what D-dimer even is, how it's measured, all the way to the limitations, and even a peek into the future, what could be possible.
Definitely covered a lot of ground.
And I hope our listeners are walking away with a good grasp on it all.
Oh, I think so. D-dimer demystified, right?
Exactly. And the key takeaway, as always, knowledge is power. The more you understand about D-dimer, the better equipped you are to be your own health advocate.
Couldn't agree more. It's about being informed, asking the right questions, feeling confident in those conversations with your doctor.
So, as we wrap up, any final thoughts? Something for our listeners to chew on as they continue their own health journeys?
Well, we kept coming back to that analogy of D-dimer being like a smoke detector.
Right.
Alerting us to those potential clotting issues.
Right.
But sometimes, as we said, it can be a bit too sensitive, going off even when there's no real danger.
Those pesky false positives.
Exactly. But what if, and this is where it gets really interesting, what if we could refine that smoke detector, make it even smarter? What if, instead of just sensing smoke, it could actually tell us what's burning?
Oh, wow. Okay, I like where you're going with this.
Right. Imagine knowing, with more certainty, whether that elevated D-dimer is from a clot, from inflammation, something else entirely.
That would be game-changing.
It would. And that's the promise of all this research happening right now. Scientists are really working to unlock the secrets of D-dimer, exploring its different forms, what they can tell us about different conditions.
So it's like we're moving from a basic alarm system to this high-tech security system, right? With cameras and sensors that pinpoint exactly what's going on.
Exactly. And that's the exciting direction we're headed in, towards more personalized, more precise medicine, where we're not just reacting to problems, but we're predicting, preventing, and even personalizing those treatments based on a deeper understanding of what's happening at the molecular level.
It's a future where we're all a little more in control of our health, a little more empowered.
Absolutely. And it all starts with that awareness, with these conversations, with staying curious.
Couldn't have said it better myself. So to our listeners, keep asking those questions, keep learning, and never underestimate the power of knowledge when it comes to your health. It truly is your most valuable asset.
Well,
and on that note, we'll wrap up our deep dive into the fascinating world of D-dimers. Until next time, stay curious, keep exploring, and as always, stay well.
thanks for joining us, everyone.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey, one step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.